Okay, so good day to us, and welcome to today's section. So we're going to be looking at sample management. So sample management is an important aspect of the quality management system. Sample management is part of process management. So basically, it deals with the pre-analytical aspect, even the analytical aspect. Okay, so what are the learning objectives? So at the end, we should be able to describe a system for sample handling, including collection, transportation, receiving, storage, retention, and safe disposal. Now, we should be able to list down sample collection error that could lead to incorrect results. Then we should be able to list the content that should be included in the laboratory handbook. And establish criteria for sample acceptance and sample rejection. So these are the key aspects. I will. Okay, trying to do some. Yeah. So yeah, let's say uh, the lab has performed PCR for influenza virus sample, let's say from a particular hospital. Now, most of the results are negative. Now, the medical staff from that hospital tells you that their patient presents all the clinical signs of influenza. What do you think is going? What are you going to check? What will you do? So imagine a diagnostic center perform a PCR for influenza virus on a patient from a particular hospital, and most of the results comes out negative, and yet the uh, medical staff or the clinician from that hospital is telling you that most of the patient present symptom of influenza. So what are you going to check? What will you do? Just keep that. You can answer that at the end. Now, so quality management system, these are the 12 quality system essentials. So sample management is part of what? Process management. For those of us who are not quite familiar with drug quality system essentials, we have organization, personnel, equipment, purchasing and inventory, process management, information management, document and record, non-conforming event management, assessment, continual improvement, customer focus, facility, and what? Safety. So sample management is part of what? Process management. There are other aspects of process management, like quality control in semi-quantitative, quality control in quantitative testing, quality control in qualitative testing. All these are part of what process management. Now, the quality of a result of any lab examination, any lab test is only as good as the integrity of the sample you receive in the lab. Now, so the samples are part of all the major raw materials used in getting the result. So if the quality of the sample is not good, definitely you are not going to get a good result. So garbage in, garbage out. So the quality of any result of any lab is only as good as the integrity of the sample receiving that. So in other words, if the sample has lost integrity, you don't expect a good result. So how we manage the sample, how we collect the sample, how we store the sample, how we transport the sample, how the sample is received, what condition, everything, processing of the sample, storage of the sample, disposal of the sample, all forms what is known as for sample management. Now, the importance of proper sample management. What are the importance of proper sample management? Why should we have proper sample management in our lab? One, proper sample management will help you. It's essential for accurate diagnosis to help your results. It will influence therapeutic decision. It has what? Influence over the laboratory what efficiency. Can have what we know as can directly affect what? The patient outcome. These are critical core components of the importance of what? Sample management. Essential to the accuracy of your results. It influences the laboratory efficiency. It influences therapeutic decisions. It also have direct effects on what patient outcome. Now, what are the components of this sample management? What is the component of this sample management? Part of the component of this sample management involves collection and preservation. How is the sample collected? How is the sample preserved? Other aspects include labeling, packaging, and transportation of the samples, accessioning, processing, and tracking of the samples. Others include storage, retention, and disposal of the sample, transportation to other labs, and information that is needed to accomplish what? The sample. In other words, for you to be able to implement this, you should be able to have a laboratory handbook. You should be able to have lab policy. The policy for sample management. What's your policy for sample management in the organization? Then what are the processes? Then you need to have SOPs for all these various processes. That is the only way you can be able to implement what a sample management in your facility. Now, we talk about what the collection and preservation, labeling, packaging, and transportation, information that is needed, transporting to other labs, storage, retention, and disposal. So every of these aspects, every of these components, you must have a policy that addresses. What's your policy on collection and preservation? What's your policy on labeling? What's your policy on storage, retention, and disposal? Then you must have processes that are involved. Then you should also have what these processes should have a standard operating procedures. You can have a manual that collects one or two processes together, then SOPs, then you have templates for recording your activities that turns those activities to record. I will communicate. So for the laboratory handbook, we say it contains information needed by those who collect the sample to be available to all sample collection sites and areas. Must be understood by all laboratory staff and other users. So lab handbook is critical aspect of implementing what sample management. Should be referenced in the quality manual. If you have a quality manual, it should also be referenced there. So this is what are the content of a laboratory handbook? What should be the content? What should be the content? What should be the content? Now, we'll have the name, the address of the lab. Must be there in that lab handbook. Contact names and telephone numbers, who you can contact, the hours of operation. Or we operate 8 hours, we operate 12 hours, 24 hours, from what time to what time. It has to be captured in the lab handbook. Next, the list of tests that can be ordered. What is the list of tests that can be ordered? What are the sample collection procedures? Sample transportation procedure. What is the turnaround time for each of these tests? How urgent requests are handled? Complaint procedure, your advisory services, instruction for completion of request form. Because you must have a standard acquisition form, whether manual or electronic. You must have a request form. Instruction for patient collected samples. Your sample acceptance and your sample rejection criteria must be there. What the limitations of your procedures, laboratory policies on protection of what pesticide. Each amendment must contain and all must be captured in your laboratory handbook. Okay. Next, it's important for us to understand that a lot of errors that happen within the lab Over 75% of the errors happen at the pre-analytical stage. A key component of the pre-analytical stage has to do with sample management before the analytical, though there are also aspects in the so sample management is one of the management that cut across the processes. So we have sample management in the pre-analytical, sample management in the analytical, and sample management at the post-analytical aspect. Pre-analytical, before sample information is collected, sample is preserved, sample is transported, gets to the lab, sample is analyzed. After an analysis, sample is stored, sample is disposed. All these are what post-analytical and the analytical aspect of what sample management. Now, the laboratory responsibility, what's the responsibility of the lab? It provides sample collection information. What should be collected, when should it be collected, and how. What, when, and how. So you need to provide sample collection information. What sample should be collected for the test? When should the sample be collected, and how should it be collected? All this information are very critical when it comes to sample management and maintaining integrity of the sample. Next, access to all sample as examination. Provide appropriate collection supplies like containers, consumables, hand gloves, if you are using vacutainers, syringe, needles, whatever you're using, and a request form, whether a hard copy or what, an electronic copy. Next, define a good labeling system. Have a labeling system. How do you label your samples? You use barcoding, or if it's manual, what are the components of your label? What are your identifiers? So you must have a good labeling system to be able to produce good and consistent results. These are test requisition. So patient unique identification should be there. The standard requisition from the sex, the date of birth, location, what is the test that is requested, the time and the date of sample collection, what type of sample is collected, is it urine, sputum, HVS, high vaginal swab, ear swab, wound swab, whatever it is. Source of the sample, where the sample coming from. Oh, let's say, for example, if it is a histology sample, let's say you're collecting a sample like there was a surgery and maybe the breast was removed. So we need to know, is it the left breast, is it the right breast, and all those things. So those source of those samples, when appropriate, has to be there. The clinical data should be indicated. Identity and contact information of the requester or the person authorizing that test or the individual has to be there. When it comes to collection requirement, the patient preparation, patient identification, so what the patient needs to do before the sample is collected, those are part of patient preparation. Sometimes patient needs to abstain. Let's say, for example, person is doing like semen analysis. Person will need to abstain maybe like 3 days from having sex, and not more than 7 days. So all those patient preparation, let's say for example, person is coming for fasting, blood sugar test, then the person needs to fast minimum of 8 hours. So all this preparation, patient preparation is critical, because if you don't prepare the patient appropriately, then you're going to get false results. So patient identification, appropriately identifying the patient against the test requisition, type of sample that is required, so that you don't go and collect an blood sample when it is swab sample that is needed for that test, type of container that is needed. This could be confusing for some persons. Some persons are able to differentiate one container from the other from just the color. But if the person is not using the same kind of container, definitely it could lead to issues. So you can say, okay, EDTA sample, if you're using a container, the purple cap, and all those. So the type of container that is needed needs to be clearly spelled out. Labeling, especially handling, safety precaution. All samples will be treated as suspicious, as hazardous. So that's why you need to put on your safety precautions when handling samples. These are sample collection requirements: PPE, head covers, goggle, face masks, face shield, gowns, aprons, gloves, boots, and etc. So providing sample collection information like this, you could do something like this within your sample collection area. This is a fingerprint. This is like a job aid. So with this now, the person is able to do this procedure appropriately or for a fingerprint. Now, labeling sample. Most importantly, the patient name, date of birth, the age. For the date of birth, you put it there. You need to define whether you are using month, day, and year, that MMDDYY or DDMMYYY. And the age. For the age, the last birthday of the person is the person's age. Even though it's just one day to the person's birthday, the last birthday in the person's age. So let's say, for example, somebody last birthday was 32, and just tomorrow to be 33. So as of today, when you're collecting the sample, the person is 32. Is that okay? Thank you. Patient unique ID number, test ordered, time and date of collection, and the collector initials. So all these things has to be well expected. The outcome of the improper sample collection. When samples are not properly collected, it brings delay in the report test, unnecessary collection and retesting, decrease in customer satisfaction, increase in cost, incorrect diagnosis treatment, can lead to injury, can lead to death, can even lead to litigation. I've seen where people are sued for wrong sample collection or improper handling of samples and etc. that could lead to one or two things. Most importantly, the client, the patient will be disgruntled. It could increase its cost. I've seen people travel for 6 hours to a particular place for the sample to be collected. Imagine someone travel 6 hours and for you to collect the sample, and upon trying to get the result, you say the sample was not properly collected. The person needs to travel back to for you to collect the sample. You need to travel 6 hours to go and get the sample. So these are very, very important. Now I want to talk about sample receipt procedure. Sample receipt procedure. So when samples are received, what should be done? You need to enforce your sample rejection criteria. What are your sample rejection criteria? You need to verify that sample, or you need to record it on your register or your log or your system, your laboratory information system, hospital management system, whatever you are using. Enforce sample rejection criteria. Unlabeled sample means labeled sample. When the samples are broken, when samples are leaked in the tube, insufficient patient information, hemolyzed sample, depending on the test requested, sample collected in the wrong containers on the wrong tubes. All this should form part of what? Sample rejection criteria. So part of your sample management, let's say in an audit, we ask you, do you have a sample rejection and acceptance criteria? If you don't have it, it shows you that you don't properly manage your sample. Because where there are no rules, definitely a lot of things can go wrong. So you need to enforce what? Sample rejection criteria. And also when you have a sample rejection, we also need to see those samples that have been rejected, a documented evidence that you are enforcing or your sample rejection criteria. Then verify the completeness of the test request, the appropriateness of the sample, the information on the label. Then record, you could use paper, you could use computer based, include all the information on the requisition form and store and save it. Let's look at some sample register log. This is a typical example of some sample register log. Can be electronic and paper based. The register should include the date and the time of collection, date and time of receipt of the sample, what is the sample type, what's the patient name, the demographics as required, laboratory and sign identifications, the lab ID number, then the test to be performed. All these, many more, must be captured in the sample register. Action for rejection or action for rejected sample. When you reject sample, what do? You inform the requester or their representative. Request another sample. Record the rejected sample. Retain rejected sample based on reset criteria. So another second side may request testing as suboptimal. Let's say, for example, if the clinician say, okay, this sample has to be tested no matter what the condition of the sample, then sometimes you need to ask him to whether send an email or you're going to document beside it that, oh, this sample is not sufficient, but so and so clinician, so and so doctor, so and so person insist that we run a sample like that. And on your result, they must do a disclaimer too that, oh, this result was run under the circumstances, and the lab is not responsible for the outcomes of the result. Now, sample tracking. Use sample tracking sheet, log, or could be log or computer. Confirm receipt of sample, including the date and time. It's important that you label sample appropriately. Keep with the test requisition until the laboratory ID is what? Assigned. Track aliquot. The aliquot will be traceable to the original sample. So the same label, the same thing that is in the aliquot should be also be what in the same original sample. Let's say for a computer base, you could track sample by identification number, patient information, collection date and time, the type of sample, test to be performed, name of the healthcare provider, location of the patient, could be ward, clinic, outpatient, the direct test to be done, time and the date the result was also what reported. Handle all sample as if it is what infectious. Follow standard and transmission based what precaution. You don't handle sample with your bare hand. Say, oh, that's not the key. No, it's keys. Every sample is regarded as hazardous. It's potentially what infectious. So you don't use your empty bare hand, go and pick samples, and you see at the end of the day, wash. You may just end up contaminating yourself, contaminating your family and loved one. Now let's look at another aspect: sample storage and retention. Develop policy that defines how long should a sample be stored. Every sample, how long should it be stored? What is the retention time? What's the location? Proper condition, method of organizing your sample, indexing. So let's say, for example, you are storing sample, you don't just put it like as if you are throwing dustbin. You need to what? You need to index it in such a way that when you want to retrieve it, you are able to track it. Designated sample storage facility. Monitor your storage conditions such as temperature. So when you are storing those samples, you have to storage condition, whether it is histology, hematology samples, chemistry samples, microbiology samples, you have to monitor storage condition. Why do we monitor the storage condition, the temperature? So that, because if the temperature is not optimal, definitely can lead to deterioration of that sample. I want the sample, the essence of storing sample is so that in case you want to use the sample, maybe for the testing, checking, or validation, anything you want to use it for, that sample has integrity is intact. If integrity is not intact, then that sample has no value. Are we communicating? Sample storage and retention. Monitor store sample, including freeze or sampling. Those sample you put in freezer, store sample. Maintain an organized and accessible system. You can see all this stored sample in freezer. Establish a schedule to check all stored samples. Establish your tracking procedure. They have control of access to store samples. So everybody should not just have access to your sample that is stored. You must have control of access to that stored sample. Now let's look at sample referral. For sample referral, first you record sample referred, the date of referral, time of referral, name of the person referring the test that is requested, the referring laboratory, the transporter or the courier. All this has to be recorded when you are handling sample referral. So specimen referral processes, look at this. So let's say, for example, specimen is collected at a particular site. From that particular site, you can see that from the collection site here, during consultation, specimen collection, specimen is packaged, specimen is transported to different means, gets to the lab. So the lab reception record analyze the test, release the results. The result is transported to the facility either electronically or physically. The result is received at the people utilizing the result now. The result is received, recorded, issued result to the patient, treatment options, surveillance, public health restrictions, and etc. So this is specimen referral process. from the collection site to the specimen transported to the lab that the sample is referred to, then the result is being transported back to what? The lab or the site that we utilize what? That result. Okay. No, monitoring sample referral. It is essential that you monitor and track and record what's your turnaround time, result delivery from the referral lab to the requester, then problems with referral. So let's say, for example, they tell you that the sample is going to be ready in 5 days. So you need to track, oh, is this sample? Because if you don't track it, at the end of the day, may say 5 days, 5 days, you are not getting your result, and you have told your patient, let's say 6 days. At the end of the day, your patient comes, your client comes and asking for his result. Why you are not getting the result from the referral lab? Result delivery. How is the result delivered? Yeah, electronically to your LIS, physical copy, hard copies, etc. Problem with referrals has to be monitored. Now let's look at sample disposal. Set policy for your sample disposal based on your national or international regulation. Could be your state regulation or your national regulation. Follow the established biosafety and biosecurity guidelines and procedures. Yes. Note that establish authorities for sample what disposal. So where you dispose your sample, you must have like, depending on where you are, like an SLA between you and the person who's collecting the samples. And most of the time, it's advisable you know how the sample is being, where the sample is being disposed, so that samples are not just taken from your facility and taken to somewhere and disposed uh, and anyhow, thereby causing public health what hazard and public health nuisance. Sample transportation. So maintain integrity of the sample. When you are transporting sample from A to B, you have to maintain the integrity of the sample. The temperature has to be optimal. Preservation of the sample. So there are some samples that need preservatives to be transported. Some require special transport containers. Time limitations. Ensure biosafety and biosecurity regulations are met during what? Transport, sample transporting. They also have what we call sample transport regulations. They are developed by, we have guidelines like National Transport Regulation, IATA Transport Regulation, Railroad, Sea Traffic Agency, Postal Courier, Private Couriers, those regulations, whatever they tell you to do, whatever the regulation, you need to follow that so that your sample does not get mixed up. I've been in a situation or I've seen an organization whereby sample was transported and in the country where the sample was received, the sample, because it was not properly packaged, at the end of the day, the sample had issues and the government have have to ban that sample, has to impound the sample. And these are samples of people, tissues of people's parts of different people and etc. So sample management is not a roadside thing, it's not for non-profit, it's a professional job and has to be handled professionally. Processes has to be put in place to ensure what things are done appropriately. SOPs has to be there, training has to be there for the people who is handling it, monitoring of it has to be there. But I've seen an organization whereby in every key department area, they have a quality assurance manager. So for sample processing, they have a QA manager for it. For the analytical, they have a QA manager. Why? To ensure that what they get the best. So transport regulation and mandatory compliance violation leads to penalty, deals with accident and speed to reduce biohazard, safety, courier, laboratory staff, passengers, and what, etc. What are the categories of infectious substances? One, category A, we have infectious substances. Category B, we have biological substances. And category C, or we have exempt humans and animal specimen. These are categories of infectious samples, category A, B, and animal specimen and etc. So what are category A? Category A is known as what? Infectious substances. These are substances which are transported in a form that when exposed to them or caused to human or animal are capable of causing. So when you are transporting this specimen and they are exposed to human beings or animal, They are capable of causing permanent disability. They can be life-threatening diseases, can be fatal diseases, can lead to all this. Example of it is like Ebola virus, monkeypox virus, bacillus and anthracis for the culture only. All these are known as what? Infectious what? Samples. Category B is biological substances. Biological substances that do not meet the criteria for inclusion in category A. So example, it could be streptococcus, staphylococcus, and salmonella. All these are what? Biological substances. Exempt human, animal specimens. Substances not known to contain infectious material. Substances are unlikely to cause diseases. Example, it could be neutralized or inactive substances, environmental sample like water or food, biopsies, dried blood spot, decontaminated medical and clinical waste. All these are part of it. Then next, let's talk about transport of infectious samples. When you are transporting infectious sample, what do you do? It is important to follow the applicable regulation while transporting specimen. Packaging requirement differs from each category of sample. It's all called triple packaging. Triple packaging. Um, that I'm going to teach you in the next class, the final class, and all those things. So you need to package the sample in such a way. Please read it. Triple packaging. So two assignments. One is go and read order of draw in sample collection. Order of draw. What is order of draw and what is the order of draw? Number one question, what is order of draw? Number two, what is the order of draw? What is order of draw and what is the order of draw when it comes to sample? Then next, read about triple packaging. So this I'm going to send to us. I will expect you to do the assignment and also I can send it to you at the end of the day, which will go to help us to end of the so transportation of infectious samples, it is important to follow an applicable regulation when transporting the specimen. Packaging requirements differ from each category of infectious sample, infectious A, category B, and etc. Marking and labeling should be in line with the category of specimen to be what transported. Ensure that staffs are trained in proper transportation of infectious what substances. So that's why I asked you to go and read about triple packaging, order of draw, and triple packaging. Now, in summary, the laboratory is responsible for proper sample management. The laboratory should provide information to all those involved in sample collection, establish and implement a system for tracking sample as they move through the laboratory part of workflow, establish and implement a policy for sample storage and sample what disposal, ensure that all transport requirements are met. Now, listen, the laboratory must have quality sample in order to ensure accuracy and reliability of the testing and confidence of the result. In other words, when the quality of the sample is affected, definitely you can't be sure, you can't be confident about the result you are giving. So the quality of sample collected is directly affect the quality of results, garbage in, garbage out. Sample management directly affects the patient care and the public health outcomes. Now imagine there are some projects we have done in some years. I would go to feed, we go to one of the most remote villages corners. We get this subject, maybe we are doing a research already, like a national survey. And we collect these samples, and these people you collect the sample, you may not even see them again. Imagine you collect the sample is not properly managed or properly stored. At the end of the day, you have wasted all the resources, you have wasted the study, you have wasted a whole lot of things. So, sample management is not for non-professional. It's a key aspect, a core aspect. It's a major business. It's a major part when it comes to laboratory processes. So all samples should be treated as potentially infectious and therefore must be handled following best biosafety and biosecurity practice. So this is the assignment, the third one. So you answer two, one out of this, no, two out of this. The first one is what is of order of draw. What is order of draw and what is the order of draw? Then next is triple packaging. Then you pick two of this exercise and work on. So I'm going to review that. So that will form the conclusion of this course. Develop sample acceptance and rejection criteria for your lab. What should be the main content of the laboratory handbook? Generate a list of possible errors in sample management and how they could affect what patient care. What problems and challenges do you frequently encounter in sample management? So answer any of these two questions. Yeah, with the first two questions, then I gave you. I will review that individually with you and we'll get it up and running. Okay, thank you. Just a minute.